Good morning, everyone. My name is Shum. Today, my team members and I are going to talk about the underlying problems within the healthcare systems, which prevent them from meeting the holistic health needs for Aboriginal people, and what can be done in order to meet these needs. This presentation is divided into 5 sections and will be given by these orders. I will start by discussing the barriers within healthcare systems.
I'm Jeongmin Shin. Today I'm going to talk about the strengths of Aboriginal community control health services.
I'm Jiyoon Kim. I'm going to review a collaboration between Aboriginal health workers and nurses.
I'm Garam Cho. I'd like to discuss the reasons for the higher rates of discharging against medical advice among Aboriginal patients and what can be done to reduce the incidence.
I'm Hyeonyeong. I will examine the disadvantages experienced by Indigenous people with intersectional identity.
Aboriginal people define their health as the harmony between the community, their lands, and country, in terms of physical, emotional, spiritual, and cultural health. However, there are some barriers within the healthcare systems which prevent them from meeting these needs. Language is the first barrier. English is not necessarily the first language used by Aboriginal people. When healthcare workers use non-native language in communication, the patient may not fully understand their health condition and how to adhere to their medical treatment. As a result, confusion may be created within Aboriginal patients when diagnosis and treatment are not explained in a way that is compatible with their culture and beliefs. Another problem is the limited resources available to treat the specific needs for Aboriginal patients. Due to the lack of resources in remote areas, Aboriginal patients need to be routinely transferred to the city hospital to undergo treatment. The lack of funding may not allow a family members to accompany them to the city hospital. This can create a barriers for Aboriginal people, as they may feel a lack of support. The next common barrier is the lack of cultural awareness within healthcare settings. Healthcare providers may not have enough cultural training and sensitivity to take care of Aboriginal patients. For example, they may not be aware of the importance of family involvement in patient care, and they might not be aware how inappropriate it is to arrange different gender patients to use the same transportation. And finally, the conflict between the Western treatment and traditional healers can diminish the spiritual connection within Aboriginal patients. As Western treatment focuses more on the disease rather than considering a patient as a whole, this can lead to the patient losing some of their cultural identities. In order to meet these needs, now I'm going to hand over to Jeongmin. She is going to talk about the responses of Aboriginal community control health services in meeting the needs of Aboriginal patients. Thank you.
Thank you, Ting. Hello everyone, I'm Jeongmin Shin. Today I'm going to talk about the strengths of Aboriginal community control health services. Okay, let me begin that what the Aboriginal community health service is. This service is defined as a primary health care operated by the Indigenous community and for the Indigenous community. There are a number of benefits of these services, including comprehensive care, highly accessible health services, and highly trained workforce. Firstly, these services can satisfy Indigenous people's holistic care needs. As Ting mentioned, Indigenous people's view of health is holistic, encompassing physical, psychological, cultural, and spiritual areas. To satisfy their complex healthcare needs, Aboriginal community services can provide a diverse range of health services, including child care, family support, drug and alcohol services, and health promotion program. Another strength is high accessibility to healthcare for Indigenous people. Aboriginal community services can provide free transportation, a more flexible system of appointments, and outreach and home visits. Aboriginal community health services can also deliver culturally respectful healthcare services because they're from the local community, so they can understand indigenous people's specific care needs. This can make indigenous peoples feel more satisfied in this healthcare. According to research, Aboriginal community services are 23% better at retaining indigenous peoples than mainstream healthcare. So, this improved treatment adherence can contribute to better health outcomes for indigenous people. Lastly, Aboriginal community services are the largest employers of indigenous people. According to statistics in 2013, Aboriginal community service sector employed more than 3,000 indigenous people. The improved employment can increase indigenous people's access to resources. In addition, Aboriginal community services can be significant providers of professional and cultural training, which can result in more skilled indigenous health workforce and culturally respectful healthcare environment. Through these benefits, Aboriginal community health services can contribute to closing the health gap between indigenous people and non-indigenous people. So, the Australian government should support and invest more money in this service sector, and indigenous health professionals need greater representation in community services to improve indigenous people's health and well-being. Thank you.
Thank you, Jeongmin. I'm Jiyoon Kim. I'm going to discuss Aboriginal health workers' strengths and limitations in interdisciplinary collaborations and partnership with nurses. According to Jeongmin, interdisciplinary collaboration is a combination of different professional perspectives to achieve a common goal, such as closing the gap. Aboriginal health workers are important to deliver improved health services to indigenous people. First of all, Aboriginal health workers have an innate understanding of Aboriginal cultures. Their understanding is helpful to deliver culturally safe care to indigenous people. Also, Aboriginal health workers can be a cultural mentor to non-Aboriginal nurses to increase their awareness of Aboriginal cultures. Last but not least, they are able to support non-Aboriginal health workers to communicate effectively with indigenous people. However, Aboriginal health workers are generally based in primary health care, so their participation in some acute health situation may be limited by their scope of practice. Institutional racism frustrates Aboriginal health workers too. In addition, insufficient recognition of Aboriginal health workers as professionals and unclear division of tasks are the other limitation. To optimize Aboriginal health workers and nurses' role, above all, building a strong partnership is very important. Mutual respect and trust are essential in a successful partnership. Furthermore, using a professional practice framework and nursing practice summary guide is helpful to delegate tasks. The professional practice framework is informative to identify Aboriginal health workers' scope of practice, and nursing practice summary guide support registered nurses to identify situations when Aboriginal health workers' involvement will be beneficial. In conclusion, nurses can cooperate with Aboriginal health workers by reflecting on the professional frameworks and delegating tasks with respect. So Aboriginal health workers can provide culturally safe nursing to Indigenous people. Thank you.
Now, I'm going to talk about discharge against medical advice, which is known as DAMA. I'd like to focus on the DAMA of Indigenous patients. According to the research, the rate of DAMA among Aboriginal patients is 7 times higher than that of non-Indigenous patients. Why are Indigenous patients more likely to self-discharge from hospitals? We'll first look at the common health system factors for the higher rates of DAMA among Indigenous patients, and then I'd like to recommend how we can improve the Australian health system to reduce the rate of DAMA among Aboriginal patients. Now, let me begin with the common health system factors. A lack of cultural safety, institutional racism, and limited transport support can cause the DAMA of Aboriginal patients. The government report shows that only 1.6% of health providers are indigenous Australians, so the Australian health system, which has insufficient indigenous medical staff, may not ensure the cultural safety of Aboriginal patients. In addition to a lack of cultural safety, many indigenous patients still experience institutional racism during hospitalization, so they may be reluctant to receive long-term hospital care due to systemic racism. The other health factor is insufficient transport support. Indigenous Australians, in particular those who live in rural areas, have limited transport options, and many Australian hospitals do not provide transport support for Aboriginal patients. So limited transport support can cause the DAMA of Aboriginal patients. Now, I'd like to move on to the next part of my presentation. How can the Australian health system reduce the DAMA of Indigenous patients? As Jiyoon said before, Aboriginal health workers can contribute to delivering culturally safety care. So one strategy is the recruitment and retention of Indigenous medical staff. However, many Indigenous medical staff have trouble with integration into hospital settings due to discrimination and unspecified rules. So it is crucial to combat discrimination in health system and clarify the role of Indigenous medical staff. Thank you. That's the end of my part. I'd like to hand over to Jeong.
Thank you, Garam. This is Hyeonyeong. The last topic of this presentation is health concern of and services for the intersectional group, which is indigenous people with sexuality and gender diverse identity who are LGBTI, lesbian, gay, bisexual, transgender, and intersexual. This intersectionality can cause various physical and psychological health problems. Talking about physical health concern, they are highly vulnerable to STI, sexually transmissible infection, and BBVs, blood-borne viruses. Their intersectionality put them at high risk of STIs and BBVs. Another reason for this vulnerability is stigma. The stigma on this population exacerbates these health problems by excluding them from society and bothering them to use health services. When it comes to the psychological problem, they show the high rate of depression and suicide. This is mainly because of discrimination on LGBTI and indigenous people. Also, the lack of understanding from family and community causes mental health problems. Both discrimination and poor understanding bring isolation and exclusion, resulting in many mental illnesses. Since the concept of Aboriginal health emphasizes the importance of being a part of community, isolation and exclusion is a significant loss in terms of health and well-being. In order to help them with these health problems, many LGBTI and indigenous communities run various services. Screening test service is an effective way to prevent the occurrence of STIs and BBVs. For example, organization called ACON provide HIV and STI screening test service. Counseling and support group is also vital intervention for emotional health and well-being. Through the support group, they can overcome the isolation, which is the main culprit of depression and suicidality. The community-based counseling and support group service by Beyond Blue is an example of this. To sum up, indigenous people with LGBTI identity suffer from various health problems, and there are some services to help these health concerns. Therefore, Australian government also put more effort on facilitating the use of those health services. Thank you.